Hi, I'm Rose, and the evidence-based practice I chose for my presentation was social narratives. I'm going to be giving an overview of social narratives, the evidence of it, and steps to teach this practice. What are social narratives? Social narratives are an intervention with simple stories that usually represent social situations and appropriate social behaviors. They focus on describing a targeted social behavior to the learner. According to the literature, the age groups social narratives would help are 3 to 5-year-olds to about 15 to 18-year-olds with autism spectrum disorder. Why use them? According to evidence, social narratives are most beneficial for people with autism because people with autism usually have problems in communicating effectively and displaying appropriate behaviors in social situations. By showing these students correct behaviors in short stories, the hope is they too will display them. This evidence-based practice can help learners' social skills, behaviors, joint attention, school readiness, academic, and adaptive skills. During one research study, Bakasharan investigated the impact of social stories, a type of social narrative, with 4 children with autism spectrum disorder to increase friendships and communication skills with others in the classroom. After using this evidence-based strategy, 3 out of the 4 students demonstrated improvement in their ability to make friends. There are 6 different types of interventions that could be used as social narratives. They are social stories, social scripts, cartooning, comic strip conversations, power cards, and social autopsies. They all have the same goal, and that is to display a target behavior or skill, just in slightly different ways. There are 2 examples on this slide. On the left is social stories, and the right is power cards. Social stories are one of the social narratives that most research is conducted on since it is the most common type of social narrative used. When I go over the steps for implementation, I'll be focusing more on social stories because this is the one that's most used. The first step is to identify the social situation. This step includes looking at the learner's IEP and their learning goals, then discussing with their parents and other faculty what social behavior needs change. The second step is to identify the target behavior or skill to teach and define it. You need to define it clearly so that the behavior is described so it is easily observable and measurable. The third step is collecting data to decide the baseline of the target behavior. In this step, you need to collect data on at least 3 occasions over 3 to 5 days to determine the learner's skills prior to intervention. Step 4 is to write the social narrative based on the child's needs and functioning levels. This means making sure they are written at a level of language that's appropriate so that the student can understand. Step 5 is then deciding the length of the narrative that's based on the student's learning level so they will be able to comprehend it. The sixth step is to include pictures of a person positively implementing the target behavior. You should use visual cues like multimedia and/or technology. These can be pictures or cartoons. The next step is to create a social story in the form of a book, iBook, or iMovie. Research suggests people who have autism are often visual learners, so smart board technology allows them to take part in an interactive classroom. Furthermore, the use of multimedia through visuals and audio-visual materials is important in social narratives because it lessens the cognitive load. According to research study conducted by Sani Bocart and colleagues, the more interesting something is, the more likely someone is to pay attention and be engaged. Therefore, using multimedia in social story increases the engagement and thus is more effective. The eighth step is to implement the story by reading the social narrative to the child and modeling the desired behavior. This should be done daily. The ninth step is to monitor by collecting data on the target behavior. Monitoring occurs to measure effectiveness. It's important to ask others that work with this student to measure the behavior too, so you can see the behavior across settings. The second to last step is to review the data and results. Modify if needed. This means if it's not working, you can't continue to keep doing the same thing. This means you have to modify how you are implementing it. One way you could do this is by reading the story more often. The last step is the maintenance of learned behavior or skill. In this step, you need to promote maintenance of the targeted skill by using the narrative less, which you could do by increasing the time between readings. And if this doesn't help, then reintroduce the social narrative again more frequently. Take a moment to read this over. This is an example of a social story. This social story is simple and has visual cues. It shows the behavior, it shows what not to do, and then shows what to do instead that in the end will help the student feel better. Overall, social narratives can be very beneficial in helping students with autism spectrum disorder learn a behavior or skill that will help them in a social situation and with their communication skills. The use of visuals and making sure the language is simple and to the student's level are important factors in social narratives. Now that technology is such a used thing, this also can be helpful to implement it. Social narratives displayed on smartboards are shown to be effective and help with engagement.